Hi, you alright guys, Matt here. Basically today we're talking about the heart is the most important muscle in the body simply because it controls how you train. Basically if you can't train hard it's because your heart won't let you. And this is because of fatty deposits in your arteries, or you don't do enough cardio to keep your heart strong. Your heart needs to be trained constantly. You do long distance cardio, aerobic training, your heart's going to be stronger, your BP is going to go down, that's your blood pressure. Your resting heart rate is going to go down, meaning that you can train harder for longer.
So here you go guys, this is the heart just here, and I'm going to take you through the blood flow through the body. So this here is deoxygenated blood that goes up through here through the vena cava. You have the superior, which comes from the brain, which is at the top here, and then inferior, which is from down here, which is from the rest of the body. So deoxygenated blood goes into the right atrium, which is here, and goes into the right ventricle through a tricuspid valve, which is located here. And this is so when the right ventricle does contract, no blood goes back into the right atrium, as this can cause heart attacks and stuff like that. So once it's gone through into the right ventricle, the muscle round the heart here then contracts, sending the deoxygenated blood up through here, which is the pulmonary artery. You can get that out right. Into the lungs. And now the lungs are obviously very important if you're doing aerobic activity. Now what I've done here is I've also done another drawing. So here you can see the lungs, which are here, and this is the bronchioles. Inside these, well not inside, attached to them are the alveoli. Now the alveoli store the oxygen when you breathe in, and also have the carbon dioxide when you breathe out. Now if you look a little bit closer down here, you've got the oxygen in the alveoli, and from the pulmonary artery there's capillaries, because the artery goes into arterioles and then into capillaries, there we go, and they go all the way down these bronchioles and down to the alveoli, and this is where gaseous exchange takes place. And this means basically the CO2 gets swapped for the O2, and when you exhale, all the CO2, carbon dioxide, will go out. And this is where the oxygenated blood now goes back into the left atrium. Now I'm using red here for oxygenated, so this here is now all oxygenated. This is the left atrium, and to get to the rest of the body it has to go through a bicuspid valve, which takes you into the left ventricle. Now after it goes through that, it now goes into the aorta. Now the aorta is a very thick artery, simply because the amount of pressure that's going through it, because all this here, if I use the black pen, all this here is solid muscle. Now as you can see in the heart, this side is a lot thicker than this side, and that's not because of shit drawing. I've purposely done that because that's the way the heart is, and that's simply because blood has to be pumped all the way around the rest of the body and back up to the brain. So as you can see here, I've got the aorta, which is a thick artery, but I've only actually just drawn the aorta here, but that's not the only artery that comes off the left ventricle. There's actually a right coronary artery that runs all the way down here, and now this coronary artery, for a lot of fat people that don't stay healthy, gets blocked. Now this is very unfortunate, because this coronary artery and the left circumflex artery that goes down here, and the left anterior descending artery, which goes down here, are actually blood supplies for the heart, for oxygenated blood, so that they, just like any other muscle, the muscle needs oxygen. It needs red blood cells. Okay, so if this gets blocked, you're gonna get a heart attack basically and die, which is pretty shit, to be fair. But yeah, as I was saying, but if you want to keep this healthy, it's down to your nutrition. It's down to your exercise. If you don't keep your exercise up, basically you're not going to be able to get rid of the cholesterol in your veins and your arteries. And if you are training hard with this pressure on the arteries, you're going to pop something. Basically, you're not going to feel well. The oxygen's not going to get to the muscles. Your oxygen's not going to get to the brain. You'll faint. You can actually get brain damage from that. So really what I'm trying to say is get your nutrition right, get your carbs, get your protein, all that sort of stuff. Get your cardiovascular up. Your blood pressure will decrease if you get rid of the cholesterol. If you get the alveoli increasing, get the amount of capillaries increasing in your lungs, therefore your resting heart rate will go down because your heart's getting stronger, more oxygen's being able to pump through the body but less heartbeats. Therefore the heart's not on as much stress and you become healthier and fitter. Therefore exercise comes a lot easier to you, especially if it's low intensity.